At the end of this video, you should know more about diarrhea and its epidemiology, know the signs and symptoms of a patient with diarrhea and dehydration, know how to treat dehydration, know how to identify malnutrition, know how to detect a cholera outbreak, and know how to advise on food and water safety. All over the world, diarrhea is a leading cause of death in babies and children under 5 years old. Diarrhea is usually caused by infection of the intestines and can occur anywhere, but is more likely where communities lack access to sanitation and clean water. Some of the most common infectious agents include bacteria, for example, Salmonella or Shigella, viruses, for example, rotavirus, norovirus, or adenovirus, or parasites, for example, Cryptosporidium, which is common in people living with HIV, or Giardia, which is commonly found in travelers. Remind your patients that by having their children vaccinated, Expanded Program on Immunization or EPI, will prevent the commonest cause of severe diarrhea in young children, rotavirus. Diarrhea does affect adults, but is particularly dangerous in babies and young children. It deprives them of the nutrition needed for growth and weakens their immunity, making them vulnerable to other illnesses. The main symptom of diarrhea is loose, watery stools that are more frequent than normal. A sudden onset of increased frequency of stools that are looser than normal, with or without vomiting, must be managed as diarrhea. Other symptoms to look out for include nausea and vomiting, abdominal pain, fever, blood and/or mucus in the stool, and dehydration. Dehydration can be classified into 3 categories: severe dehydration, Plan C, some dehydration, Plan B, and no visible dehydration, Plan A. Severe dehydration is when a child has any 2 of the symptoms listed here: lethargy or unconsciousness, sunken eyes, poor ability or inability to drink fluids, severe decrease in skin turgor when a skin pinch takes more than 2 seconds to return. Then this can be classified as Plan C. Some dehydration is when a child has any 2 of the symptoms here: restless or irritable, eyes sunken, thirsty, drinks eagerly, moderate decrease in skin turgor by slow skin pinch returning in less than 2 seconds. Then this can be classified as Plan B. No visible dehydration is when a child has only 1 or none of these symptoms: restless or irritable, eyes sunken, thirsty, drinks eagerly, moderate decrease in skin turgor by slow skin pinch returning in less than 2 seconds. Then this can be classified as Plan A. Should the child be classified under Plan C, the following treatment should be administered: sodium chloride 0.9% IV 20 ml per kilogram. If there are signs of acute severe malnutrition, decrease the bolus to 10 ml per kilogram over 10 minutes. Repeat up to twice if radial pulse is weak or undetectable. Continue with 20 ml per kilogram every hour for the next 5 hours. If after 5 hours the child is not feeling better, then refer urgently for further management, continuing with 20 ml per kilogram every hour for the next 5 hours unless the child is reclassified as some dehydration. Reassess every 2 hours while awaiting transfer. If hydration status does not improve, give IV fluids more rapidly. As soon as the child can drink, usually after 3 to 4 hours in infants and 1 to 2 hours in children, also give oral rehydration solution taken orally 5 ml per kilogram per hour. If IV administration is not possible, insert a nasogastric tube. While awaiting and during urgent transfer, give the child oral rehydration solution, NG, 20 ml per kilogram per hour over the next 6 hours. If only oral administration is possible or the condition is not improving, transfer the child urgently. Reassess and reclassify the child every 4 hours. If there is improvement, reclassify as some dehydration and treat accordingly. For Plan B treatment, start giving the patient oral rehydration fluid immediately. Either mix and administer a packet of rehydration salts from the clinic, or you can create your own by mixing 8 level teaspoons of sugar and only a half teaspoon of salt in 1 liter of boiled, cooled water. Ensure that you use only half a teaspoon of salt, as excess salt can cause more diarrhea. Oral rehydration solution should be administered orally as described, 80 ml per kilogram over 4 hours, for instance, 5 ml per kilogram every 15 minutes. Give more if the child wants more. Show the caregiver how to give ORS with a cup and spoon using frequent small sips. If the child vomits, wait 10 minutes and then continue more slowly. Encourage the caregiver to continue feeding the child, especially breastfeeding. If after 4 hours there are no signs of dehydration, treat as no visible dehydration. If after 4 hours there are still some dehydration signs, continue with Plan B. If after 8 hours dehydration is still present or has become severe, refer for further management. According to Plan A classification, the caregiver needs to give ORS with a cup and spoon using frequent small sips. Encourage the caregiver to give ORS orally 10 ml per kilogram after each diarrheal stool until the diarrhea stops. Children under 2 years of age, 50 to 100 ml. Children over 2 years of age, 100 to 200 ml. Continue at home. Encourage the caregiver to continue feeding the child, especially breastfeeding. Instruct the caregiver how to make ORS at home and to continue treatment. The child should return to the health facility if condition does not improve, fever develops, condition deteriorates, eyes are sunken, poor drinking or feeding, slow skin pinch, or blood in the stool. Refer the child immediately if they have severe dehydration, failure to maintain hydration on oral fluids or feeds, in other words, failed Plan B. Children with danger signs, for example, convulsions, altered level of consciousness, intractable vomiting, inability to feed or drink. Children with dysentery or bloody diarrhea should be referred to a hospital. If they are under 12 years of age, show signs of dehydration, malnourished children, suspected acute abdomen or another surgical problem, a child with severe dehydration accompanied by blood or mucus in their diarrhea needs to be referred to a hospital or clinic immediately. All children should be assessed and treated for associated conditions, for instance, hypothermia, convulsions, altered level of consciousness, respiratory distress, and surgical abdomen. Malnutrition is also a common cause of diarrhea. Malnourished children's immunity is weakened so that they are unable to fight infections, and this can lead to repeated episodes of diarrhea, which then furthers the malnutrition. If you notice the child is not growing well according to their growth curve on the Road to Health booklet, or is presenting with consistent diarrhea, refer them to hospital. They may have something else that is causing them to not grow. Food safety. Follow the World Health Organization's 5 rules. Keep the cooking area and utensils clean. Store raw and cooked food separately. Cook food thoroughly. Keep food at safe temperatures. Use safe water and raw foods. Educate patients about how to make sure their drinking water is safe by boiling water in a clean container for 1 minute, or chlorinating water by adding 1 teaspoon or 5 ml of household unscented bleach like Jik to 20 to 25 litres of water, or 3 to 5 drops to 1 litre of water. Cover the water and let it sit overnight or for at least 2 hours. Know the signs of dehydration and start oral rehydration immediately. Diarrhea may also be associated with other diarrheal diseases with the following symptoms. Bloody diarrhea, consider dysentery. Diarrhea with high fever or extremely ill, consider typhoid. Diarrhea in children in the context of an adult epidemic, consider cholera. If cholera cases have been reported in the area, please be alert, especially in adults with watery stools and particularly if they are dehydrated. Be alert for patients having certain things in common. They may have watery or bloody diarrhea. They may live in the same area. They recently ate the same food. They may share a water source. Or there may be an outbreak of diarrhea in a neighboring community. These cases may need to be notified on the Notifiable Medical Conditions app. According to the Notifiable Medical Conditions rules, the following need to be notified within 24 hours of clinical or laboratory diagnosis. If they are diseases that need to be notified under Category 1, for example, cholera. Enteric fever, that is typhoid or paratyphoid fever. any foodborne disease outbreak, which is defined as 2 or more cases in the same community, or listeriosis. Thank you for watching this video. Please remind your patients and community health workers that childhood immunizations are important, that they should recognize the signs of dehydration, and that they should bring a symptomatic child to a clinic as soon as possible. Please remind your colleagues that all children should receive their immunizations and, if missed, should receive catch-up vaccines. Notifiable medical conditions need to be reported. TB screening is important. HIV testing is important, as are ARTs for all those testing HIV positive.